This is Dr. Jerry Hesch. I'm a physical therapist at Hesch Institute in Aurora, Colorado. And my client fell down 13 steps. And most of her pain is in the upper lumbar, lower thoracic region, and tailbone. And she presents with a very rigid pelvis. I would expect much greater mobility based on age and body type. And there's just no side glide on either side. And when I try and induce posterior rotation of the pelvis, there's just no give whatsoever. I can't take up the slack because it's rigid. Let's have you lie on your stomach, please. You can move that little thing for your face if you like. And we see the same pattern of rigidity when she's on her stomach. And you can look at other videos that I have posted on YouTube where I show spring tests through the pelvis. And I'm putting a reasonable amount of force. And I'm putting even more force than I usually do to get a little bit of movement. And it feels like I'm pushing on a block of granite. In relationship to the PSISs, the sacrum is more posterior, and that's a pattern that I often see with falls. And there's no movement, no perceivable movement with inferior glide to the ilium on either side. Pushing on the sacrum, there's no give. Going superiorly through the ilium, there's no give. Going anterior on each ischium, there's no give. So it's just an extremely rigid structure. Very unusual. And the sacrotuberous ligament is out here, and it feels like bone. It's supposed to have a little bit of yield. And so I believe that this pattern was created in the fall, and I believe that we can improve mobility. And so I'll stop filming here, and we'll go to work and we'll treat it. And I will also work to increase hip rotation and hip extension, and she presents with the side bent coccyx to the left. We will correct that also, and I'll film the response to treatment. And the name of this pattern is posterior glide fixation of the sacrum.